Now, let's talk about COVID-19 as we continue on this issue. We said a record number of positive cases being recorded. And the WHO saying that through its General Secretary, Tedros Ghebreyesus, earlier on. Now, the African National Congress itself has said it warmly welcomes the outcomes of an extraordinary China-Africa summit on solidarity against COVID-19. The summit was a joint initiative between the People's Republic of China and the Republic of South Africa, and its capacity as chair of the African Union, and the Republic of Senegal in its capacity as the co-chair of the Forum on China-Africa Cooperation, or FOCAC. Now, the summit acknowledged the massive challenges posed by the global threat of the global spread of the COVID-19 pandemic, with specific reference to the major impact on the lives and health of the people of Africa. The summit discussed areas of cooperation. Acting Ambassador for the People's Republic of China to South Africa, Li Nan, joins us now to talk about this. A very good evening to you, Ambassador. Thank you so much for speaking to us. So the Secretary General of the UN, Antonio Guterres, and the Director General of the WHO were part of this meeting. Talk to us about the importance of the Africa-China cooperation within this multilateral context.
Yes, thank you very much. Thank you for having me here this evening. Actually, last week we just successfully concluded the extraordinary China-Africa summit on solidarity against COVID-19. This summit was held at a very critical time as the virus, as the pandemic is ravaging across this continent. And we hope, through this, we have reached the leaders from the 3 countries and also from other 13 countries, and as well as some of the multinational organizations like AU, UN, and also the AU chair, and also Dr. Tedros from WHO. I think the leaders have reached the consensus on solidarity against COVID-19, and they have reached the consensus on solidarity of international cooperation, and they have reached the consensus on solidarity of upholding multilateralism, and also they have reached the consensus on the construction of a closer China-Africa community of a shared future and a community of public health. Yes, it's a very significant summit, and I'm sure the implementation will come up afterwards.
And just the difference of opinion we've seen, not only of handling the disease and the vulnerability, especially to people in Africa. You have your own experiences that you've learned and you continue to learn. We've seen now that there are new infections in Beijing. What advice and help can you offer Africa, especially South Africa, in this regard? You have a new cluster of infections, and some of this you say is important. So how do you prevent some of these?
Yes, it is true that locally transmitted infection from Beijing's largest wholesale food market was first reported on June 11th. And as of yesterday, more than 200 cases have been confirmed. And after the reporting, actually, Beijing has now imposed the lockdown restrictions, measures, and also rolled out the massive testing of this virus. But as of up to now, I think more than 2 million people in Beijing have taken the nucleic acid test. And the good news is that now the number of newly increased infected cases has dropped from double digits, roughly 20 to 30 people per day in the past few days, now to only 9 or 8, under 10. So I think that's a very good progress. And I think the great experience we learned from is that if we have found some infections, and people must have the public conscious this, to report it to the authorities. And the authorities must be quick to take actions to prevent and control the spreading of that. You know, even right now, the travels to Beijing, to and from Beijing are currently prohibited, and the schools and universities remain locked down. And also, we have practiced a new method that is kind of a health code system. And, you know, for every people in Beijing, they are required to download an app, you know, of this health code on their cell phone. So their cell phone will detect the, you know, the risk of each of the holders of getting infected. For example, for the green code, that means you can travel to anywhere in Beijing.
Okay,
but for the orange code, that means you have 7 days for quarantine, and the red code, you have to have 14 days of quarantine. But now everything is under control.
Unfortunately, we have run out of time. Acting Ambassador for the People's Republic of China to South Africa, Li Nan.